Between businesses reopening and families traveling over the 4th, public health experts say this weekend could spark another spike in cases. Dr. Alex Eastman is the Senior Medical Officer Operations at the Department of Homeland Security. You know, you've traveled around the country for DHS. What are you seeing in the states that are slowing the spread that we aren't doing here in Texas?
Yeah. Hey, Chris, good to see you. Always glad to talk to my hometown team here in Dallas. You know, it's interesting. I wouldn't say that we're unique to other places around the country, but one of the things we've noticed is that, you know, since Memorial Day, we've clearly seen that in younger folks, particularly under age 40, that I think we just haven't taken this as seriously as we probably need to right now. And so as we move forward in the response, we really have to look to see to each of us to make sure that we renew our sense of personal accountability and make sure that we protect ourselves and protect those around us. Truly vital right now.
I want to take a look at the numbers in a different way just for a second. I'm curious about the death toll because as of yesterday, Michigan and Illinois have 2 to 3 times as many deaths as Texas. And in fact, we're on par with Indiana, which doesn't even have as many people as Dallas-Fort Worth, much less the entire state of Texas. Why have patients had a better outcome here?
You know, Chris, I think it's a little bit early to start drawing inferences like that in terms of better and worse outcomes. I think we're in the midst of the pandemic right now, and I do think we have seen, and certainly since Memorial Day, and certainly in the last 3 weeks, we've seen a real preponderance of cases amongst those under age 35, and that, you know, probably has a variety of etiologies. But if you notice, and certainly in my travels, you know, I've been home here in Dallas too. I've seen more people gathering and less people wearing masks and doing the things that we really need them to do. I think it's important to note that, you know, this isn't about whether the economy is open or whether the economy is closed. It's about what we do to protect each other. And, you know, I'm in a room where I don't have anyone else here. I'm distant from the people that are close by, but I've got a mask right here. And as soon as I'm here in the hospital, working in the hospital today, as soon as I leave and have to be within 6 feet of other people, I'm going to wear my mask because it's my responsibility to protect others. You know, Chris, I mean, we're Texans and we're Americans. And what we've always done when we're in times of crisis is come together and look after each other. And this is no different.
What would you say, Dr. Eastman, what would you say to people who aren't taking this seriously, or just refuse to wear a mask?
Yeah, listen, I would say, you know, this is not complicated. The virus doesn't have wings. It doesn't have an engine or a propulsion system. It's transmitted on the backs of the secretions that we put out. It's person-to-person transmission. These masks help control those secretions. And so whether the economy is open or shut, that's not really the issue. We control our own destiny by how we all act. We can get back to work, school, worship, healthcare. We can do the things that we want to do as Dallasites, as Texans, and as Americans if everyone does their part. But we can't do it in small groups. We've got to have everybody all in. And really, truly, we've said the coronavirus stops with me. It stops with each one of us, and we all have to do our part.
All right, Dr. Alex Eastman from the Department of Homeland Security. You led Dallas's response to the Ebola crisis, so we're hoping that in this pandemic as well, we have a good outcome. Thank you, Dr. Eastman, for your context.
You bet, Chris. Thank you.